So I got right just inside of that nostril. Is that inside or outside of my body? It's still kind of outside of my body, right? I can actually take a wire. We'll do this later on, I'll show you. To a volunteer. I can take a wire and shove it up their nose, into their nasal cavity, down into their nasopharynx, down into the oropharynx, down to the laryngopharynx, down into the larynx, down into the trachea, down into the bronchi, down into the bronchioles, until it ends in these little clusters of sacs called alveoli, without going through a single membrane, without passing through a single cell, which means technically it never went inside of the body, because inside of the body means it's crossed a membrane.
Couldn't you use that same argument for eating then? You just say like the food went down through three intestines and so that's still inside.
But there is a door. But there is a doorway.
Oh.
Like for instance, the lower esophageal sphincter at the where the esophagus meets the stomach. There's a doorway there, and then there's another muscular doorway at the other end of the stomach, and then there's another kind of a doorway at the ileocecal valve, ileocecal junction. But you're not completely wrong either, which is why I also call that stuff that comes out leftovers. Because if you couldn't break it down, you couldn't absorb it, it just keeps going through. So you're not completely wrong, but there are doorways. Here, there's no doorway, there's no membrane that I put this wire through. And it can get all the way down into there. Now, that's confusing because people say, well, yeah, but you create mucus in there, that's sort of inside your body. Well, it's not really inside, it's the line. It creates a lining on the inside, but it's not actually inside any more than, you know, the mucus that drips out of your nose. So it's interesting to think that the air that is inside of our nostrils is the same air that is out here, right? Yes?
Mm-hmm.
Yes. And the air that then is in our pharynx, in our throat, is the same air that's out here, and the air that's in our larynx is the same air that's out here, and the air that's in the trachea, the bronchi, the bronchioles, and the alveoli is the same air that's out here. The only difference is we've done a few things to it. We filtered it. Why did we filter it? Why do we filter this air?
So we can get the O2 out of it and the CO2.
Well, so the bad stuff doesn't find a place to survive inside of those bronchi and bronchioles, alveoli. We've also have changed the temperature because our lungs are a warm and moist environment. So if the air is cold, we're going to warm it up. Our lungs are a warm and moist environment, so if the air is dry, we're going to add some moisture to it. But we tried to filter out all the stuff that we don't want to go deeper and deeper and deeper down into that area. But otherwise, it's the same air. But that's why we have all that filtering, which means we have to have mucus here. We have to have mucus here. We have to have mucus here, 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 here. And we do. And that helps to trap those things. And then we have to have some way from here to move it up again, to move that stuff up and out. And we do. We'll talk about that a little bit later on. The ciliated cells that help to move the mucus with the trapped particles up and out. So don't get me wrong. You will hear everybody talking about how it's entered your body if you breathe it in. It's inside of your lungs, so it's inside of your body. And I get that. But I want you to be aware that actually, technically, it's still not inside of the body until it crosses the membrane or goes through a door. And that does happen in the lungs. We do have particles that cross the membranes. Oxygen molecules cross the membranes. Carbon dioxide crosses the membranes. So this right here is a pretty simple diagram. It includes most of the parts that we're going to talk about, except for the oxygen exchange parts that you can't see here. And then, of course, the diaphragm, this part here. The diaphragm is that dome-shaped muscular structure that separates the thoracic cavity from the abdominal cavity. It is a dome-shaped structure that when it contracts, it will become more of a flattened structure. It has to, right? Because we know that when muscles contract, they get shorter. And for a dome to get shorter, it means it's going to have to contract like this. It's going to look less like a dome. And that is what's going to cause air to come rushing into our lungs. Yes.
2 questions.
Yes.
So at what point is it laying flat when we're like inhaling, exhaling?
Well, it's not, when I say,
Sorry. I'm just wondering what it does as we're inhaling and exhaling.
Okay. Dome-shaped muscular diaphragm.
Mm-hmm.
Now, this is only a part of it. This is only what part of it looks like because it sort of comes back and down. But when I say that it flattens out, it does not go like this
That's what I figured.
because
It just
that
gets
would be
shorter.
extreme. It goes from dome-shaped to less dome-shaped. But just for understanding purposes,
As we're
Here's what's
inhaling and
happening.
exhaling?
not as we are. This is what causes us to inhale. As that diaphragm contracts in here, in the thoracic cavity, that's going to cause the air pressure inside of here to become lower than the air pressure out here. To give you an example of what that means, if you blow up a balloon, you take a balloon, you're going to make an animal out of it, and you blow up this balloon, now you've created air pressure inside of the balloon, right? And you know that because if you let go, the balloon's going to go as air comes rushing out of it. What you've done is you've created more air pressure inside of the balloon than the air pressure outside. So the air pressure is higher inside than outside. So which direction does the air want to go?
Out.
Out. It wants to go from where it's a higher pressure to a lower pressure. When this diaphragm contracts and flattens, it creates a lower pressure in here. And as you just said, air wants to go from where it's a higher pressure to a lower pressure. That means the air pressure out here is higher than it is, thanks for passing that on,
Sorry.
as it is in here. So now the air pressure is going to force air to come rushing in. So it's like the reverse what would happen with a balloon.
Mm-hmm.
And then as that diaphragm relaxes, air passively moves out. It's not getting forced out.
Mm-hmm.
It's just passively moving out so it can become equal again with the outside world. So it's that contracting of the diaphragm that causes the change in the air pressure, makes it lower in here so air comes rushing in.
Okay.
So as we sit here, not thinking about it, breathing in and out, okay, well now you're thinking about it. But as you're sitting here earlier not thinking about it, breathing in and out, moving about 500 milliliters of air in and out of our lungs, that is what is happening. However, we do know that even after you breathe air out of your lungs, you can still
Force it out.
force more air out. And that's because there's more air still within our lungs. As we sit here and breathe 500 milliliters in and 500 milliliters out, there's still air in our lungs. We force that out by contracting all these other muscles. Like those intercostal muscles, remember those delicious muscles?
Mm-hmm.
Covered in barbecue sauce. And some of the muscles here. All that together is helping to squeeze the lungs. We take advantage of this when someone is choking on something. And it gets lodged in here, in this air tube. We take advantage of the fact that we know there's more air in those lungs. So what we want to do is we want to force that air out. So we want to get the lungs and just squeeze them. And that will force the air that we know is in there to push whatever's in the way out like a cork out of a champagne bottle.
Gotcha.
However, you can't just squeeze the lungs because The ribs are here.
Yeah.
So what we're gonna do is we're gonna find the only soft area, which is underneath. And that's what the Heimlich maneuver does. We're forcefully going in and upwards. What you're trying to actually do is squeeze the lungs. And that helps to take whatever's there and push it out, hopefully.
Now, my other question is, like, like on Pat here, is it true to say that the diaphragm, like, I guess starts at the 12th rib and goes up, or I mean at the, like, yeah, maybe 5th lumbar? No,
Lower, I'll show you. I think you can see it.
that's what I'm like kind
You
of.
can see it on Pat here. Okay, just put all that in. This here is all diaphragm.
Oh, okay.
That's why I said it's not just this part, it actually goes down behind as well.
Gotcha.
Now, I'll show a picture of that a little bit later on. And you can see here, there's an opening right here, as a for instance, where the aorta comes through.
Oh,
You can
okay.
see here, there's an opening where the esophagus comes through, because remember the food tube is going to deliver food to the stomach. Well, the stomach is down here in the abdominal pelvic cavity.
Oh, wow.
So in order to get to the stomach, that food tube must travel through the diaphragm. So we do have some openings in the diaphragm. We have to.
Gotcha.
Okay. So let me read off the slide like a good instructor would. Shut up. The respiratory tract. Oh, in my head, it's hilarious. The nose, of course. That's how we breathe. Okay. The nose, we breathe the air up and through our nose. And you see there's little bony projections here called the terminates, or they call them the conchi. These three bony projections from either side. Let me think. The reason they exist is because as we breathe air in, we know that that air is going to be probably different than our lungs. Our lungs are this warm, moist environment. So as we breathe air in through our nose like this, what's going to happen is that air is going to get whipped around those terminates. And as it does, it has the opportunity to pick up some moisture, has the opportunity to pick up some heat. Because remember, the lungs are a warm, moist environment. Say it.
Lungs are a warm, moist environment.
That was sad. It really, say this again. The lungs are a warm and moist environment.
Lungs are a warm, moist environment.
Which means the air going in. Which means the air going in. We want to be warm and moist.
I thought you said though, our body will turn it to the temperature we need it, like if we breathe in cold air.
Yes, that's part of it. That's part of the process of making it warmer.
Okay.
So those little terminates there give the opportunity for the air to whip around. Nasal cavity goes back and connects to the throat, the pharynx. Now remember, there's three parts to it: nasopharynx, oropharynx, laryngopharynx. The throat. I think I pointed this out before that people were literally confused about where the throat was located. Yes? Yes.
Yeah.
Big tongue. Big old giant ugly tongue.
So wait, what all is the throat?
Here to here.
Interesting.
The nasopharynx, the oropharynx, the laryngopharynx. Actually, we'll see a picture in just a little bit. That goes down and branches off into two tubes. One is a food tube, one is an air tube. The food tube is the esophagus, a muscular flattened tube that sits posterior to the air tube. It starts off with the larynx, that's where we find the true vocal cords. And then that becomes the trachea. And trachea extends all the way down to where it branches off into a right and a left main stem bronchus. Bronchi plural, bronchus singular. Each one of those branches off, goes into a lung, branches off into smaller bronchi, which then become smaller bronchioles, which then end in clusters of tiny sacs called alveoli, which we'll see later on. Notice the lungs. There are two, right and left. You'll notice the right lung has 1, 2, 3 parts to it. The left lung has 1, 2 parts to it. Why is that? Why is the left lung smaller than the right lung?
Because the heart's on the left side.
The heart takes up some space here. Good. Respiration. Remember, ventilation is the movement of air, right? Inspiration is breathing in, expiration is breathing out. One inspiration and one expiration equals one respiration. One breathe in, one breathe out. How do you count that? First of all, it's counted per minute, right? Respirations per minute. As a medical assistant, how do you count respirations per minute? You watch their chest moving. Yes.
Or you can put your hand on their back.
Yes. And you count how many times that happens
4 minutes.
for a minute. The problem is this.
People are gonna get nervous.
If you're staring at somebody's chest like this,
They're gonna change their breathing
they're
patterns.
gonna change their breathing patterns, exactly. They'll be like, what was this guy doing? And then they're gonna realize, oh wait, he's counting my respirations. Maybe I'm not breathing enough. Maybe I'm breathing too much. So when you do this, when you count the patient's respirations, it's gotta be on the slide. It's not something that is easy to do. This is a skill you have to practice. One way they probably taught you is that when you're taking their pulse, you take the pulse for the first 30 seconds, then you remember that number, and then for the next 30 seconds, you just sort of pick a spot, like a button or a logo, and count the respirations for the next 30 seconds. And then take each of those numbers and double them to get beats per minute and respirations per minute. But it is a trick. It is something that you have to practice. Functions of the respiratory system. Exchange of gases. Well, what gases would those be?
O2 and CO2.
Oxygen, carbon dioxide. Regulation of blood pH. I talked about this a little bit. Remember, carbon dioxide travels in the blood not as carbon dioxide, but as bicarbonate, HCO3 minus, the most potent buffer we have in our blood. So, depending upon how much CO2 we need will determine how much will be released and how much we'll breathe out. I don't know if I list protection as a function. I would say that there is protection within the respiratory system, but I don't know if I would say it's a function of the respiratory
I
system.
would say that it protects because, as you said, when there's extra air in our lungs, we can force stuff out if necessary, and we can force
Okay.
stuff out in general.
All right. Go away, bear! Or if you're being chased by a bear.
Yeah. Screaming,
Keep it extra
that's
like,
protection.
wait, why did you just yell, go away, bear? Is there a bear in the building again? Voice production. I think you know what that is. Making sounds like the one I'm making right now, or right now, or right now. And olfaction, which I have no idea what that means. Does anybody know what that means? Yeah.
Maybe you're
Like
doing it right now.
Smell.
I didn't do it right now, yeah. Smell. Smell. Olfaction is smell. Why is that important?
You need to smell.
Why?
What if you're in
It helps
like
us
a building
recognize
and you
things.
smell- You can't smell gas because you're about to die. You need to smell.
Like
You're in a building,
recognition.
you can't
And there's
smell.
like a gas leak
There's a
and
gas
like you're
leak.
about to die.
You're
and
about to
No one
die.
else smells it. Well, you can't smell it because like you don't even got a nose. You can't smell.
I have no nose. Anosmia. The lack of a sense of smell is what that's called. Okay, you got that. Bad smells bring bad things. Like if you smell a bear, they stink. Oh, bears. Go away, bear. Oops, I thought they had a pop up there. Pulmono,
Lung.
lung or air, spiro,
To
or spira, to breathe. Okay. The nares are the opening for the nostrils. Septum, what does septum mean?
Wall.
Wall, what's plural for septum?
Septum.
Septa. Septa. So there is a wall between your nostrils, did you know that?
Mhm.
Yeah, of course, it's on the other side.
I thought I just had one big nostril.
It becomes one big nasal cavity back here. But,
I don't know.
yeah,
I don't think I have the septum.
you do. Yeah, well, you also have a little bone, a little plow-shaped bone goes right down the middle. Part of it, except part of that bone. The palate, the palate. The palate. The palate is the roof of the mouth here. There's two parts to it. There's a bony palate made up of the maxilla. Remember the maxilla? What was the top teeth?
Mhm.
And a soft, fleshy palate that goes beyond that. And the soft, fleshy palate eventually becomes the uvula. The uvula is that little punching bag hanging down part. You remember the uvula. Okay, maybe not.
Yes.
It actually flips up a little bit when you swallow.
I think I
Yeah.
noticed.
I talked a little bit about the epiglottis here, this lid-like structure which flips down to make sure that food goes down the food tube and not down the air tube. This actually flips up just a little bit as you swallow to try to keep food from going up into your nostrils, unless you're drinking milk and you start laughing, in which case it comes shooting out. URI stands for
Upper respiratory
Upper
infection.
respiratory infection, yes. Now, what causes upper respiratory infections? No, what causes it? Which is, yes, you're right. What type of pathogen is that?
Bacteria.
No.
Virus?
Virus. Common cold is a virus.
I thought it could be both. No.
Hmm?
I thought it could be both. Like it could be bacteria or virus.
Not for a common cold. The common cold is defined as just a virus. Can bacteria cause upper respiratory infections?
Maybe yes.
Maybe yes, or absolutely yes.
Yes.
Absolutely yes. So when we talk about upper respiratory infections, mainly we're talking about bacterial infections or viral infections. Could it be fungal?
Yeah.
Could a fungus cause an upper respiratory infection? Of course it can. Could it be parasitic?
Yes.
Probably, yeah. But when we talk about upper respiratory infections, what are we really talking about most of the time? Bacterial or viral? Rhinitis, or the older term coryza, but we say rhinitis because everybody understands what that means. Inflammation of the rhinoceros. No.
That makes sense.
Inflammation of the nose, that's right, rhino means nose. Allergic rhinitis is caused by what?
Allergies.
Allergies. Okay, easy enough. Bless you. How about sinusitis?
Isn't that like that?
It will. It
Inflammation.
is like that, but what does sinusitis actually mean? What's the definition?
Inflammation of the sinus.
Inflammation of sinuses. And the sinuses are here. They travel this way to here.
That's why they
So wait,
give you a headache.
In the bone.
Like,
Well, not all that way back there. You're like to here or back this way or
well,
down
it's
right to my
nowhere.
knee.
Everywhere.
Here.
Okay.
And they're really just empty spaces. They have a little mucus lining in them. And the reason they exist is to make the skull lighter. Less bone mass, less heavy. And then again, people will tell you, well, it also changes your voice. The resonance makes a different sound, which is true, but that's not why it's there. It happens to do that. So when they become infected, well, what follows infection? Inflammation. It's followed by swelling, edema. Deviated nasal septum, what does that mean? That sounds like a lot of
Isn't
things.
that like
Like offset.
a broken end or something like that?
Oh, the walls, yes, in some ways been moved or manipulated, yeah. And epistaxis, this is a good one. Epistaxis, this is a nosebleed. Now, what's the most common cause of nosebleeds?
Dryness?
I didn't hear.
Dryness?
Dryness? No. Getting punched in your nose.
Really?
We're doing
Well, I don't know if I'm gonna say punched
Or
in the
just
nose,
trauma in
but trauma in general is the most common cause of nosebleeds.
Couldn't it be from like,
I heard
like
That
being
includes a
dried
kid,
out?
think
that
that.
includes a kid picking his nose.
Wouldn't it be like, it's like dry in there?
That's trauma?
No,
Them
No,
cause
like
that
a
causes a
kid.
nosebleed, but it's not the most common cause of a nosebleed. That's
I
why
mean,
I
I
asked.
mean the
Oh,
kid
all
thing.
right.
What I asked was what's the most common cause? Why does it dry out then?
Cause it's not, there's no mucus.
Why? What happened to it? What happened to your mucus? Where'd it go?
Slowed in production.
Somewhere. Cleveland.
You blow it out.
No.
Bye.
How about when you turn the furnace on at night, when you go to
Yeah.
bed and you're sleeping? Remember, the furnace dries out the air.
And the
Well,
air breathing's drier.
your body's trying to add moisture to that air, so it does. It picks up the moisture. But if you have really, really dry air because your furnace is on, it's going to dry out those mucous membranes completely, which is then going to cause them to crack, create these little fissures, which is going to cause the capillaries to leak blood out. So how can you stop that from happening? Other than, don't say, well, don't turn the heat on. Well, then you're going to freeze to death and die.
A humidifier?
A humidifier would it be the thing to use? We're going to add moisture back into the air. That's a good idea.
I thought that happens in the winter though too.
That's
Is
what
that
it-
just because we're using heat? It's not
yes.
because the air's cold, like to, I guess if it's cold, there's moisture.
There's still moisture in it, yeah. Yeah. What else? How about this one? High blood pressure.
Oh, I didn't know that.
Patients
Oh yeah, that makes sense.
Patients that have such high blood pressure that at times will have spontaneous nosebleeds. Capillaries will rupture.
Oh, I didn't know
What else would cause like random nosebleed besides that?
Bleeding disorders
Really?
like hemophilia, von Willebrand's disease, Bernard-Soulier syndrome,
Ebola.
Glanzmann thrombocythemia.
That's
Oh, Ebola, hemorrhagic disease would definitely can definitely cause nosebleeds.
Did you see the
Yeah.
thing about Ebola this morning?
Are people, no, we.
No, I didn't see it.
It's and somebody being tested for it at Penn Hospital in the city.
We're here? Huh? No, oh my
Yeah.
gosh.
We're treated for it. They don't know what happened yet. They're just being treated, or not treated, they're getting testing done on it. It was posted an hour ago.
Here we go.
Ebola.
Class dismissed. I'm going home into my bunker.
I think we're gonna be afraid today.
For the, wait for the zombie apocalypse
They
to
said that there's
begin.
an outbreak in
Did anybody watch
Congo,
Sturgeon?
Africa. And they don't know if that person came from there or came in contact with someone.
I watch it
who
with
was
it all the
from
time
there.
with my daughter.
So they're just being
How they got a
tested right now.
bunker, so
We'll
the
test
burgers
it.
won't get them. That's gonna be Dr. Sturgeon.
Wait, why are you looking at me?
I did not hear about this.
I'm going with.
And I'm surprised because I didn't get an alert or anything.
No, it's just on ABC. right here.
I'm also looking at too, but
Pennsylvania hospital test patient for possible Ebola exposure 2 hours ago.
Oh,
At
Because the last
University of
time,
Penn
yeah.
Hospital.
Last time there was the patient that was in, where was it, Wisconsin, I think? And I got an alert, like, almost immediately, so it's weird, okay.
Yeah, box 29 reported it.
Okay, so yeah, Ebola can cause a nosebleed. Disseminated vascular coagulation can cause nosebleeds.
so people say, like I be seeing my little cousin used to get nosebleeds, and she like, oh, it's just 'cause it's hot. It's so hot outside. So is that true? Like, she right or wrong?
She maybe, if it's really hot and dry outside.
Oh, okay. I didn't know she done.
She,
He said when it get hot, he says.
That's not over there, it's like he overheats a lot in his
Oh, so people do get hot and get nosebleeds. Alright.
We overheat.
but, yeah. Okay, so here's, if you look here, and this extends down a little far. It's not quite this far, the laryngopharynx. But if you look, this is the throat, ladies and gentlemen. Or no, I'm the gentleman. Ladies, this is the throat. So look where the chin is, right?
Mhm.
That actually almost comes, because this is a little bit far down. It actually is more like right here. So it's almost in line with the chin, which surprises people because most people think if they point to their throat, you say, oh, somewhere down in here is my throat. No, actually, it's more like up this direction. Divided into 3 parts, naso, oro, and laryngopharynx. Now, the easy way to designate this is tell the person to open the mouth, stick out the tongue, say, ah, look straight back. The area you see straight back there is the middle part, the oropharynx. If you got a little dental mirror and stuck it here and looked up, you'd see the nasopharynx. If you twist it around, look down, you'd see the laryngopharynx, which is actually more like from here to here. So, yeah, almost in line with the chin. That's where you would find that. So that is something, again, people are often confused about. People are confused about a lot of things, aren't they? They still call this whole thing,
the stomach.
and they're wrong.
Oh, it is all over the news.
Okay,
Wait, what is that?
great. I'm going to be the last one to know about this. This is incredibly embarrassing. Upper the boca, the ah, the ah. And what do we see when we look inside? The uvula hanging down like a punching bag. The tonsils on either side, and these are called the palatine tonsils. There are different tonsils. But when somebody says they had their tonsils taken out, these are typically the ones they're talking about, the palatine tonsils. Just above and behind those are the adenoids. You can't see them, but they do pretty much the same thing, or a very similar thing the tonsils do as far as part of the immune system. The tonsils do a job. They have a thing that they're supposed to do. However, they can become more of a problem than they're worth. And when that happens, what do?
Take them out.
Take them out. And then what do? We make fun of those people as they're walking down the street. Oh, look at them, they don't have tonsils. Ah. No.
No, okay.
Do they live their life perfectly normal?
Yes.
Yes. Again, back in my day, back in the 1930s, when we were growing up, kids used to have their tonsils taken out routinely by the time they were 5 years old. Doctors just snatch them out. And now we know better. We know we don't just cut away tissue. All right. Let's take a break. Oh wait, don't take a break yet. I don't think you're scared. Define the following root elements. I'm going to add the O's on here just because it makes it easier for me. Naso and rhino. What does naso mean? Nose. What does rhino mean?
Nose.
Nose, okay. But then here, these two, muco and perulo. You definitely want to know these. I'm telling you this just because it's going to make your life easier. I'm telling you this because it's going to make your life easier. What does muco mean?
Mucus.
Mucus. And remember, there's two spellings to mucus, right? M-U-C-O-U-S and M-U-C-U-S. What's the difference?
The mucus is inside the never mind, I'm gonna stop talking. Something like that.
I think you're on the right track.
Yeah, I knew that, but I don't know how to
The
finish
stuff
the
that
thought.
drips out, M-U-C-U-S.
Yeah.
Oh, okay.
Stuff
The-
that stays inside.
The cells that make the M-U-C-U-S, M-U-C-O-U-S. So like the membranes that are made up of those cells are mucous membranes, M-U-C-O-U-S.
Okay.
The actual stuff that drips out, M-U-C-U-S. Okay, so what about perulo?
Mucus.
No.
Okay.
This is an important one to know for life. I'm telling you, it'll make your life easier. Perulo means pus. Pus. Because you'll hear patients will have a purulent discharge. So what does that tell you?
Pussy
A
discharge.
pussy discharge. And what is in pus?
Bacteria.
Could be bacteria,
Infection.
infectious particles, definitely. Broken down infectious particles, white blood cells, maybe some red blood cells. Things that the body's trying to fight off stuff with. Some waste product of bacteria. And I want you to realize this about bacteria.
It's an angry little bacteria. Oh, not the dead bacteria.
It's a dead bacteria. Bacteria create two types of waste that can be dangerous. Exotoxins the bacteria creates like poo.
Bacteria poo too.
Well, they're living organisms that take in products, utilize those products, and create waste.
Okay.
So, in that sense,
Interesting.
but they also have something called endotoxins. Which we'll put in here in the form of little triangles. So, those endotoxins are going to be dangerous when that bacteria dies. Because when that bacteria dies, it breaks apart. And now those dangerous substances that were inside of it are now going to leak out. So this is how bacteria can create problems inside of our bodies. They can create exotoxins, which is a waste product that can be dangerous to our cells. It can cause cellular death, necrosis. By the way, it can also wear away the enamel on our teeth, which is exactly what happens with like Streptococcus mutans. And then they also can have endotoxins that when the bacteria die, they release, and those endotoxins can then be destructive to our cells. Why would bacteria die? Well, they don't have quite the lifespan that you or I do. Bacteria might only live for a day or two, or a couple of days. But in that time, they may have reproduced several times over. Some bacteria reproduce every 20 minutes. What that means is they make a copy of themselves every 20 minutes. So if you have 10 bacteria, 20 minutes later you have 20 bacteria. That make sense? If you have a cup this size full of bacteria, 20 minutes later you have 2 cups this size of bacteria. If you have a barrel of bacteria this big, 20 minutes later you have 2 barrels of bacteria that big. So they may only live for a couple of days, but in that time they can reproduce and reproduce and reproduce. This is why some antibiotics don't necessarily kill bacteria, they just stop them from reproducing.
Oh,
They stop them from creating more copies of themselves. Because bacteria divide, they make more copies, they one, and now you have 2. So if you stop their reproduction, now you gotta do is wait them out. Let the last ones die off.
but sometimes they don't die off, right? Sometimes they just get smarter with it.
Well, yes, that's why we say take that medication until it's gone, not just until you feel better. Sometimes if a lot of bacteria get killed at one time, they release a lot of these toxins all at once.
They make you sick still.
Well, if you create a rash, for instance, all over the body. So imagine if a person went to the hospital, found out they were sick with something, syphilis, for instance,
I said it was
syphilis. And they were treated for syphilis with penicillin. And then 6 hours later, they end up with a rash all over their body. What do they think's gonna happen? What do they think happened? They're not dying. You know, what do they think? They're gonna think an allergic reaction to penicillin, right? The problem with that is, if there's gonna be an allergic reaction to penicillin, how quickly is that gonna happen?
right away.
Right away. Yeah, within minutes. If not sooner, you're gonna see a reaction. So 6 hours is a long time for a rash to suddenly appear. That's something we call the Jerisch-Herxheimer reaction. So we say, yeah, it's not a problem. You don't have an allergy to the penicillin. It was just a lot of bacteria toxin all released at once. So I say this because when we talk about pus, these are some of the things that we can find in pus. Along with these and these. You can find, as a for instance, living bacteria, as a for instance, dead bacteria, as a for instance, waste product, as a for instance, endotoxins. Which means you don't want to come in contact with it. It's infectious. Nobody cares. So anyway, very important that you know this. Purulent is pus. Very important. You'll see and hear that a lot. You'll see and hear this a lot. Snoring. What causes snoring?
Obstruction or like the.
Some sort of obstruction. There's something in the way of the airflow. And it's easy to imagine if you just think of a trumpet, for instance. A person blowing through a trumpet makes a sound, and they can change that by obstructing in different ways, by pushing down on those different, what are those called, keys? I've never played an instrument like that, those keys.
Like on a piano.
I don't know what they're called. So in doing so, the person is blocking the airflow to some extent. It's a party. Oh, it's great. Confetti everywhere. Now the question is, what's causing the obstruction? Well, we don't know. I say we don't know because you would have to find out. Could their tonsils be enlarged? Sure. Could there be a polyp in their nasal cavity? Of course. Could they be overweight? Having a lot of extra tissue compressing that area? Yes. Could they have an infection? Certainly. So there's lots of things that can cause it. But have you heard of obstructive sleep apnea?
Sort of.
Patients with obstructive sleep apnea are going to discover that they have stopped breathing while they're sleeping.
They don't own a machine, right? A machine, not a sleep, right?
Sort of, yeah. This is terrifying news to people, to find out that there's an absence of spontaneous respirations while they're sleeping. They think, oh my God, I'm going to die while I sleep.
I would.
I'm going to die, I'm sleeping, I'm going to stop breathing, I'll die. I must pay somebody to watch me 24 hours a day in case I don't fall asleep and I stop breathing so they can wake me up. So what happens is this, they get prescribed a machine that is going to create an open airway. And that is accomplished using a mask. This mask used to be, they've gotten better now, but it used to be a mask that would strap onto the face like this, and it would have a hose that would go to an air compressor that would be running all night. So they were attached to a machine, mask strapped to their face, and this would help them breathe. This would stop them from stopping breathing.
Continuing airflow.
Positive air pressure. Yes?
Yes.
Yes.
Sorry.
Now, the reality is, those masks were incredibly uncomfortable. Those masks got dirty. I mean, imagine that you're breathing into it, fogging it up, stinking it up.
And if you're sick too, and then you're sick and you have to wear that mask.
I'm sorry?
And then you get sick and you have a cold and you have to wear that mask.
Yes, sick, now you're breathing it in even more. Gross. It's cumbersome. You have an air compressor a few feet away from you running all night. Who wants to do that? So needless to say, a lot of people don't. They get this machine, they try it for a while, maybe a month later, it ends up in their closet or sitting next to their treadmill,
And those people don't
which
care
is
if
now
it's not
acts as a clothes hanger or something.
good. Those people fear nothing.
That's what I was saying. I wasn't.
But if you look around, you'll notice that the streets aren't lined with the dead of sleep apnea. You
Your body
don't, it's
wakes
not
you up.
something you hear about a lot, people dying from sleep apnea. Even though it sounds like people would die if you stop breathing when you sleep.
Doesn't your brain kick in?
But your brain kicks in and says, hey, stupid,
Breathe.
breathe.
Oh yeah, I forgot.
It sounds like that. And then they breathe again. So that's what happens most of the time. And I say this because I guarantee everybody in here knows somebody who's diagnosed with obstructive sleep apnea.
Somebody actually died on my block.
Really?
She didn't put on her machine.
Wow.
She died that night.
It's incredibly rare.
She was
She must have
overweight.
had a bad
And she was supposed to sleep with this machine on. I can't remember what they called it. I like somehow. But she was on the machine and she died. It actually happened in the summertime too.
She didn't have an aid?
She went out there at night, got drunk. She was supposed to put her machine on and sleep, and she was dead the next morning.
She might have like asphyxiated in her sleep. She
Yeah.
couldn't breathe and she was drinking.
It may have been related
But
to
they did say
something.
she was supposed to sleep in the machine.
It may have been related to something else. I would probably Steve. I would. It's just incredibly unlikely that people die from it. It's more likely that that was probably some other cause of death. How old was she?
She was like 30.
Yeah, that's really unusual. What about pharyngitis? What does that mean?
Inflammation of the pharynx.
Probably due to what?
Coughing? No. I don't know, like excessive.
I don't know either.
Well, what causes inflammation?
Trauma.
Injury or
Bacteria?
Injury.
What?
injury or
You can't leave for 2 days ever again, okay? I'm sorry. This is
I just like have to.
Right?
Don't know what it is. Right?
Injury or
One
infection?
injury or infection.
Those two
That's
eyes.
all. Yes, it's 2 eyes. Injury or infection. Those are the things that cause inflammation. Injury or infection.
Injury or infection?
Injury or infection. So what's the most likely cause in this case?
Infection.
Infection of the pharynx. And if it's a group A beta hemolytic streptococcal pyogenes infection of the pharynx, what do we call that?
Strep throat.
Strep throat. Because we do not want to say patient has a group A beta hemolytic streptococcal pyogenes infection of the pharynx. Because that just, there's a lot to write and say. So we call it strep throat. What's next? Tonsillitis. Oh dear Lord, what's tonsillitis?
Inflammation of the tonsil.
Inflammation of the tonsils, probably by infection. What about nasopharyngeal carcinoma?
Don't even
Is that
No.
in cancerous,
You said it before.
cancer in the nose and pharynx?
Oma is,
Oma's a
Oma is a
vascular
tumor.
tumor.
Yes.
yeah.
Carcinogen,
The
carcino, cancer causing. It's a cancerous tumor
Yes.
And that's it.
In
the
pertaining
nose.
to.
Pharynx.
Of the nose.
And, okay.
There you go.
Good job.
Good job. See, it's not that hard.
It
You
is-
go back to the basics. Go back to breaking it down. As long as you can identify what each of these parts mean, you break it down. And you have your definition. Give me an example of one thing that would cause a nasopharyngeal carcinoma.
Okay.
Smoking?
There you go.
Oh, I didn't know.
Why not?
Um,
Could it cause a nasopharyngeal carcinoma?
I thought it had to go in through your lungs.
The pharynx, isn't that the throat
And the nose.
and the
It's
nose?
everything you're breathing in. And that could be from secondhand smoke too,
So
right?
you can get cancer from secondhand smoke?
Yes, I can, you can, we all can.
It would have to be heavy
Yeah,
though, right?
it would have to be heavy.
Like
It
almost-
wouldn't be, you know, like when you walk into a building and people are smoking outside and you walk through that little cloud of smoke, you're like,
I hate that.
that's not gonna cause,
Oh, cause I was like crazy.
that's not gonna cause
Children
cancer.
So you have to
people
watch the direct contact.
You have to be the child who's riding in the car every day with the parents who have the windows rolled up,
Oh, okay.
and then living in the apartment with them, in the 1-bedroom apartment that's has no ventilation where they're smoking all day long. Yeah, in that case, that could cause a problem. But not from walking through that couple of people that are smoking outside.
Or somebody sitting next to you smoking, no.
If it was your parents and it was every day at the house, in the car, then yes. If it's at a bar or a restaurant, then it's highly unlikely. Because a person has destructive stuff that they're breathing in every day. And every day their body's saying, okay, this sucks, let's get rid of this, let's get it out, let's fix this problem. But it has to be constant in order for the cells to get to the point where they change. Oh, okay, well, let me go back. Well, we know what the pharynx is, right? Throat,
Yes.
broken into 3 parts, naso, oral, laryngeo, from top to bottom. So pharynx becomes pharyngeal, that's all this is showing. Nasopharynx, nasopharyngeal, oropharynx, oropharyngeal, laryngopharyngeal. Easy enough, right?
Yeah.
Yes. Now, here's something that I taught you way back on the first day. Inflammation of tonsils, tonsillitis, yeah. But on the very first day, I taught you a whole bunch of combining forms, right? And one of those combining forms was tonsillo. And what did I tell you about the combining form tonsillo?
I honestly don't remember that one.
It's not a book.
We're going to wait now for Olivia.
Well, it's not in there.
We're not going to wait.
I got this.
Tonsillo, the combining form, has two
Two L's.
L's.
Ah,
The word tonsil has one. Remember I said tonsillo has two L's. I said this is not a typo. Tonsillo has two L's. For the word tonsils is only one. Which means when we write inflammation of the tonsils as tonsillitis,
we dropped the second now.
no,
Well, that's
we have to
that's
make,
all-
we have to make sure there's a second L.
Like,
Does that make sense?
Okay.
That's what it was about.
why does there need to be another L?
Because
Tonsillar.
tonsillo is the combining form
Okay.
with two L's. It just means the word tonsil.
Oh,
So tonsillo with two L's is the combining form. So please, would somebody please tell me what the surgical removal of tonsils is going to be called?
Tonsillectomy.
Tonsillectomy, I think that sounds right, with two L's. Very nice.
That's not
Does not sound weird.
tonsillectomy.
Tonsillectomy.
Crazy.
just say surgery. What do you think, Mama?
But imagine this, if you did something simple like that. Imagine if you found out that somebody had knee surgery. Oh my God, they're taking out his knee? So he has to walk like this now? So that's why we have to be more
What do
specific.
you call knee surgery then?
Knee surgery? It
Just
depends on the type of surgery.
There's also knee replacement
That's
surgery.
just a
Knee
generic
replacement.
term, yeah, it's just a
Alright.
generic term. I'm going to go backwards here, or wait, I'll go forwards, no, I'll go backwards. I'll go backwards a bit. Okay. So you can see the area of the glottis right here. See the larynx? This is where we find the true vocal cords in the larynx. So just above that, this area is the glottis.
Right,
It's
right
not
here.
labeled on here.
It is not labeled on that one.
From like our ear to our chin, would you say?
It would be inside, just above where that blue is. You can't quite see the
Oh,
epiglottis here. Because just above that glottis is that flap that flips over. And honestly, if I want you to remember one thing, I want you to remember the epiglottis.
And what do you want us to remember about it?
That's that
That it's-
lid that flips over and it covers the air tube as you're swallowing food to make sure the food goes down the food tube.
Why is the air tube so much wider than the food tube? Or at least it looks to be.
is that a heartbeat?
That's me thinking. How many times a day do you eat?
Oh, that's often. At least once per hour.
At least once per hour.
I eat twice
How
a
many
day.
times a day do you breathe?
Constantly, gotcha.
So
He was thinking, how do I not make
we
her seem stupid?
constantly have to have an airflow moving in and out, right? We're gonna breathe in, 15 to 20 times a minute. We're not gonna swallow that much. And then we're not gonna swallow food that frequently.
I guess
And the
my
thing about swallowing food is that's gonna require some action. Which means we have to cause movement, which means muscle. So the esophagus is a muscular tube. It's gonna push food downward. So by having it as a flattened tube, when you swallow something and something goes into it, the muscle is gonna contract and push it in one direction. Create that peristaltic flow, but downwards.
I guess my whole thought was that food being the more dense of things that we intake into our body, I guess I assumed that the food tube would need to be bigger, but.
But it needs to be pushed down. So for that reason, we're gonna have the muscle involved. Well, if we're gonna have a muscular tube, the bigger muscular tube that is, it's gonna take up even more space. But we only have so much space in this area. So we're gonna give it up in one of those areas, and it makes sense to actually leave that air tube more patent, more open all the time, and make the food tube collapsible that it only goes open and pushes food down when we need to. Or up, and I say up, meaning if we're upside down, we can still swallow down. That's why we can still swallow if we're upside down, because it's a muscular force that's pushing the food that way.
So since the food's still pushing downwards, then that whole myth of can't eat while you're, you shouldn't eat while you're upside down is just
You should not eat while you're upside down.
just for like regular choking, right?
But you're right, it would increase that chance. But you can do it. I just don't recommend it.
Gotcha.
Things not to do.
I wish you looked upside down.
I actually think I used to when I was little,
Doing
It's my thing, you in the chair, upside down.
But people think that it's better to eat while you're standing because it's easier for the food to go down.
No.
People sit down.
No,
I
how
heard you
about
couldn't eat laying down.
I'm sorry?
I heard you wasn't supposed to eat laying down.
Maybe that's what I'm thinking.
Why?
Oh,
Because it's
so
easier to
not
choke.
eat. It's hard to eat laying down.
Your body is slower when you're laying down. More relaxed.
When you swallow food down the esophagus, where does it go directly? You swallow food down your esophagus, where does it go?
The stomach.
The stomach.
Yeah.
What's in the stomach?
Acid.
Acid. What does acid do?
Breaks down.
Breaks down food fibers, destroys organisms, does a lot of that stuff. So, do you always have to have this much stomach acid ready to go? No, that'd be kind of a waste of making a lot of acid. You only need about this much throughout the day as you're swallowing your saliva and bacteria and stuff like that. But what about when you eat something? Aren't you gonna need more acid? So what's your body gonna do? It's gonna make more acid. It makes sense. In fact, as soon as you start eating, your body says, oh, we're chewing stuff up, we're eating, must have food on the way, we better start making some acid. So you're gonna make more acid. Now, as you make more acid in the stomach, this is a liquidy component. Now you have a whole bunch of food stuff in your stomach, plus a whole bunch of acid mixing with it. Your stomach's sort of churning around like this, trying to mix it all together like a washing machine. Now, if you hang upside down, you have all that extra acid. Some of that acid could leak from the stomach through that doorway and go into the esophagus. Now, the problem with that is acid is very destructive. Acid is so destructive it would destroy its own stomach. But the stomach creates a big, thick barrier to protect itself from the acid that it makes. The esophagus doesn't expect to have acid there. So does it make a big, thick barrier? No. The esophagus has a little mucus lining. So as soon as that acid goes up, it starts to irritate and destroy those cells, which of course causes a pain in the chest called what?
Heartburn.
Heartburn.
Mm.
So if you've eaten a lot and you have a lot of food that's getting mixed around your stomach with a lot of extra acid, if you're lying down, now gravity is more likely to allow some of that liquidy acid to leak up into the esophagus. Now, why is that bad? Well, we don't want to destroy cells, that's for sure. We don't want to have pain, that's for sure.
Don't want to destroy the esophagus.
But if this happens over time, and those cells have to repair and get destroyed and repair and get destroyed and repair and get destroyed and repair and get destroyed, after a while, those cells, you're going to get fed up with this. You know what they're going to do?
Stop repairing.
They're going to change. And what do we call that when cells change?
Cancer.
Call that cancer.
That's not good.
This is why we take that chronic heartburn GERD seriously, because it can lead to a type of esophageal cancer called Barrett's esophagus. So we don't want people to get heartburn ever. If you get it twice a year because you overeat at a Super Bowl party and you overeat at Thanksgiving, and that happens, try not to do it. But if it's chronic, well, now we have a problem. So what we're going to suggest is don't lie down after you eat, because that's going to increase the likelihood of some of that acid that people are prone to have anyway leak up. We don't want that to happen. Does that make sense?
Yes.
Is that why say you don't? It's not about you're going to have crumbs in bed. That's not the reason why we
That's
say.
exactly what I thought it was. I thought she didn't like crumbs in the bed. I'm eating right now. I'm like,
Well, who does like crumbs in bed?
I'm really obsessive with that.
Kinda
Oh,
crazy.
every
I just
single
feel-
crumb off my bed. I'm like, nope, still feel them.
that's how deep you
Maybe if you want.
Watching Netflix like, alright.
Still feel.
Use your pillow with your hand and get all It's just such wrong.
But now I know that heartburn is serious. The people act like it's not.
Yeah, they do. They do talk
A lot of people act like, oh, it's got heartburn.
They're like, yeah, I just got a little bit of heartburn.
Yeah,
No big deal.
and again,
A lot
if it's
of it's
that twice a year because you overate at the Super Bowl party, yeah, don't do that. You shouldn't do that. But you'll be fine. But if it's happening every day, that's a problem. If it's happening every other day, that's a
A
problem.
lot of people, it's no, you know, that's like kind of what people think is normal. Like, I do know people who have heartburn often, like more than once or twice a year. And you think it's like, that's just my thing.
They're like, oh, my heartburn acting up again.
Yeah.
Like I hear a lot of people saying like, oh, I just got heartburn. I got bad heartburn. Like it's common for them to have it.
Yeah.
You do too, right?
Yeah.
So I'll let them know. Like,
But common
it's
isn't-
serious.
Common isn't a good thing.
Okay, yeah, I'll let them.
Okay, this right here is what people call the thyroid cartilage. This is the thyroid. I call this the laryngeal cartilage. Some of us call it that because it surrounds the larynx. And that makes more sense to me. And this little point right here is the laryngeal prominence,
What point?
right here. That's the Adam's apple. We all have it. It's there.
I feel it's really amazing.
That's where we find the true vocal cords, which are these flaps of tissue, V-shaped flaps of tissue. So you do it this way. That's sort of when it closes, vibrates as air comes through. Here's a fun fact that you probably didn't know. Did you know that when people drown, they don't die from water filling up their lungs?
Yes.
They die from suffocation.
Yeah.
Yes.
Did I tell you this?
No, I mean,
No.
Wow. Okay.
Darn, I thought it was going to blow their mind.
because the first thing you think when you're drowning is I can't breathe. So
Because
Makes sense.
everything just tightens up and says, there's water coming in, we don't want that.
yeah.
So the person dies of suffocation.
But then, so,
After they die,
The
all that
water-
will relax
and the water
and
gets
the water
seeps
can
in.
come in.
Wow.
But they know that like if you go into the water dead, you won't have water in your lungs, correct? That's true, right?
Like there's no Sturgeon in that.
Like you got through, like you were murdered outside the water, then thrown in, and you won't have water in your lungs. Is that
Well,
true?
everything's
No,
relaxed.
They
so.
could, there still could be water going into the lungs.
But they just
yes.
know you didn't die from drowning that way, right? If the water's in the lungs.
They
say
could
on
tell.
TV.
They could probably
It's-
tell that you didn't die by suffocation.
Yeah,
They would see like blunt force trauma or someone.
All that they said is
But-
water in the lungs, so they die from drowning. That's what I thought I saw on TV.
I know. And that comes from the thought that people drown and die as a result of water rushing into their lungs,
Oh.
which is not the case.
But I didn't know suffocation happened.
Man, I forgot my question. Oh,
What-
I'm sorry. I had a question about that. So, sorry. So then when somebody is currently drowning and they get pulled out of the water, and they start coughing up the water once they're okay again, is that coming out of like the pharynx or the larynx and everything?
Yep.
It's not. So everything's
And
down to the
lungs?
lungs.
There's probably,
It's filled
there
with
could
water.
still be some, but it's not
That comes
filled
up.
up into their lungs.
Oh, okay.
Yeah.
Gotcha.
What is laryngitis?
Infection or inflammation of the larynx.
Yes. Have you heard of this before?
Yes.
Yeah.
And what's a person sound like when they have laryngitis?
Horse.
Hoarse.
A dry cough.
You can't hear a dry cough. You can't hear their voice. Talk like this. Yeah. Not most of the time, 90-something% of the time, this is a viral infection. Which means we're not going to give an antibiotic for it.
Antibiotic.
Usually we don't even need to do that. Instead, we're going to have the person gargle with salt water.
I did hear that.
Yeah, that's going to help do a couple of things. It's going to help, one, break down some of the viral particles that are there, the cells that infect with viral particles. And then two, it's also going to cause the mucus-producing cells to produce more mucus, which is going to cause them to trap the viral particles and stop the process, or at least slow the process. And even without doing that, patients usually recover from this. All right? Patients usually recover from this fairly quickly. If a person says they have laryngitis and they can't speak, you can't hear their voice, that part usually lasts for about a day. Like the night before, they have a sore throat, a scratchy voice, that dry cough maybe, and then the next morning they wake up and they sound like this. And then this lasts for about 12 hours. And then towards the end of the night they start to have a little scratchy voice again. And then by the next day you can hear them. So for people who say they have laryngitis for a week, or they couldn't speak for a week, it's like, no, that's not true. I probably had it for about a day where you couldn't speak, but the laryngitis, the part where you had a sore throat and coughing, that could last a little bit longer. Epiglottitis, this happens usually in kids, inflammation of the epiglottis. Different, again, infection. You don't usually hear about it in adults too much. But this next one, you'll hear about. Laryngotracheal blah, blah, blah. We just call it croup, and you can see why.
Laryngotracheal bronchitis.
That's way too much. Can I just call it croup? This one time? All right.
Where did that name come from though? Like how did they?
I have no idea.
It'd be one thing if they were like LTB,
Right.
but no.
Well, we'll start calling it that then. LTBitis.
Yep.
Well, like this.
If you have kids, if you know somebody who has kids, then you've probably heard of this. The kid has a cough that sounds like a bark or almost like a whooping cough, which by the way, do you see there was a whooping cough case in like Haverton Middle School or something like that?
No,
Miss
but I've
Terry
seen
said
there's
she
a
did.
school that is infected with measles.
Miss Terry said she had
Yeah,
one
mental health.
Yeah.
Yeah,
That
I
made me
saw
go on a
that
rant.
too.
I was so mad.
That's not good.
All the good people don't want to
Yeah,
speak
seriously,
their
she
damn about
did.
No,
it.
listen.
Let's see. So here is a side view of our trachea. So right behind that is going to be our muscular food tube esophagus, if you're looking at it from a side view.
Okay.
So this is forward, this is behind. Okay, the trachea, we don't want to collapse every time we breathe air in and out. So it puts cartilage around it. However, the cartilage is C-shaped. In other words, the cartilage doesn't go all the way around it, it only goes around the front part. It is C-shaped cartilage. The reason for this is because when we swallow something, the esophagus has to be able to expand. So it expands into the back of the trachea. So the back of the trachea has to have some give to it. This is what keeps the trachea from collapsing when we breathe in and out. C-shaped cartilage. Do this. C-shaped cartilage keeps the trachea like this. Like this. No, like this. You gotta do it like this. See, like this. You gotta do it like this. You gotta do it like this. You're not doing it like this. C-shaped cartilage. C-shaped like this. C-shaped, because it's in the front. C-shaped cartilage is what keeps that trachea from collapsing. It can't go all the way around because we have to have room in the back of the esophagus. Once it branches off down here into a bronchus, bronchus left, bronchus right. Once it branches off into a bronchus, well now the cartilage can go all the way around it. It doesn't have to worry about any sort of esophagus or anything behind it. Then as it branches off into these bronchioles, the smaller branches, they're just going to have muscular walls. And by now you've realized that, hopefully you're starting to realize, that if there's a tube that has a muscular wall, in other words muscle within it, that's going to cause the tube to either decrease or increase in diameter, which is going to direct airflow in or out of different parts of the lungs. But you can see why we call this the tracheobronchial tree. And obviously incredibly important that you remember that the cartilage is surrounded, not completely around the trachea, it is C-shaped. Important that you mention that, also we didn't go into such detail. All right, the bronchioles end in little clusters that look like this. Look like clusters of grapes. These are called alveoli. This is actually what makes up most of your lung. These little clusters and clusters and clusters and clusters and clusters and clusters and clusters of alveoli. I want you to think of them this way. Think of them as being like little clusters of balloons. So as we breathe in, what happens to them?
They
Expand like little balloons would. And as we breathe out, they sort of deflate. And that's kind of what they do. So I think it's easy if you think of them that way. So they look like these little clusters of grapes. Realize that they're actually like little clusters of balloons. As we breathe in, the air goes into them. And as we breathe out, the air moves out of them. And you'll notice that sitting right on top of them are arterioles and capillaries. They look like little nets that sit right on top of each of these little balloons. So as blood is coming from the right side of the heart, remember blood from the right side of the heart is low in oxygen, it comes over through these capillaries and travels right across the tops of those membranes. As it does, it picks up that oxygen and then comes together into these arterioles, which is going to go back to the left side of the heart and is now full of oxygen again. So let me show you this. One little alveolus, one little balloon. Notice how the capillary sits right on top of it. As we breathe in, these little balloon-like sacs inflate, so air is coming in here. That air is going to have a bunch of oxygen in it. And the capillary is coming across with these red blood cells, remember in single file, because capillaries are small. And these red blood cells are low in oxygen. Remember, think of each of these as a bus that has empty seats for passengers. And as they move across here, the oxygen molecules move across these membranes, across this membrane, and across the membrane and into and on the red blood cell, taking up those hemoglobin seats. So as the blood goes across here, it's picking up oxygen, and then it's going to bring that back to the left side of the heart. Meanwhile, we have carbon dioxide that our body has created. Remember, it's a metabolic waste. That's going to move out of the blood across these membranes and into the alveolus. So when we breathe out, we expel it. This is what most of your lung tissue is doing. The majority of your lung is made up of these air spaces, which means the majority of your lung is made up of air. It's just air, a lot of air. She won't know. I don't know why. This is how the oxygen carbon dioxide exchange takes place. And what drives that? What makes oxygen want to go? Look up here for a minute. What makes oxygen want to go from here to here? What's so important? What makes oxygen molecules go from this place all the way into here?
The concentration.
The concentration gradient. Remember diffusion? Way back in week number 2, I think. You put a whole bunch of particles in one place, they're going to go from where they're plentiful to where there are fewer. Whole bunch of oxygen molecules here, not a lot here. So the thing that drives oxygen from here all the way across is just diffusion. And the thing that drives carbon dioxide from here to here is just diffusion. Remember that? If the particles are small enough, they're going to go across the membrane simply because there's more over here than there is over there.
Can you show us the lungs on the cadavers? Or you didn't get that deep into it? Come on to the cadaver in the head.
What do you want to see on the,
Yeah,
when I strip away?
yeah.
I suppose so. Here they look a lot different in this picture
I'm gonna say.
because you're looking at it from like the side view as compared to
Why is so,
the
that's
front view.
from someone smoking those black ones?
You know, see the next one.
That's why when you smoke cigarette.
That's from smoking or no?
No, that's from, that happens from talking in class. That's what happens from text messaging in class.
Oh, what?
Text messaging in class. What happens with the lungs?
Oh, yeah. It looks perfect. That's smooth.
Ooh, that looks like cancer. Or if it's single, oh, smokers? Yeah. That doesn't look like that. It's like,
Oh, so he says from smoking?
that's what this reads, but
I heard that babies can have that acid during their air symbols from having contact smoke.
You say the ears?
It's like black kids. It's just like black spots.
Oh.
that's a kidney. That's, those look healthy. Okay, the pleura is a lining around the lungs. Imagine all those little balloon-like sacs all filling up with air at the same time and all deflating at the same time. The lungs expanding all at the same time, then deflating at the same time. You would think that's gonna rub up against stuff. And it would,
That's what I was just thinking, like about the, like even with the heart and stuff.
and it would. That's why there's a double layer membrane around the heart. That's why there's a double layer membrane around the lungs. With the lungs, it's called the pleura. And in between the two layers is a little bit of fluid called pleural fluid.
Yeah, makes sense.
So as the lungs expand, it allows those layers to just glide across one another without creating any friction. With pleura. So there's two layers. Sorry. There are two layers, an inner layer and an outer layer. The inner layer is called the visceral pleura, and the outer layer is called the parietal pleura. And sorry, we know about that for now. We're gonna go over the lungs again tomorrow, on the respiratory system and anatomy. But here's an interesting one. Let's talk about this part right here on this slide, surfactant. Let's talk about surfactant, okay? Don't worry about the other stuff, we're gonna talk about some of it. Let's talk about surfactant. I see there's a lot of mucus going on in the respiratory system. Down to I could even go all the way down to the bronchi and bronchioles. Even down around those alveoli, there's membranes all over the place. If you think of these as little balloons that inflate and then collapse and inflate and then collapse, with all this stickiness happening, they would actually kind of stick together. They would collapse and the insides would all be stuck together. It would make it very difficult to get air in. So what the body does, it has specialized cells inside of these alveoli, which create a substance that is a combination of fat and protein. And what this fat protein substance is called a surfactant, or lecithin, stigmamidin, but we call it surfactant.
What is it?
Surfactant.
It's a
It's a fat and protein combination. And what that does is that allows a decrease in the surface tension or surface stickability. Another word? It allows those alveoli to not collapse and all stick together. And this is important because it's not created until about week 22 of the pregnancy. There's not enough of it for a couple of weeks. So if you try to deliver a baby way back in that time, they would get like one breath in and one breath out and then they would die. Everything would collapse and they wouldn't be able to survive in our environment. So this is actually the last thing that has to happen before a baby can be born and survive in our world. The doctors will say the baby can't be delivered because the lungs aren't mature yet. But that makes it sound like they just haven't grown enough. But that's not the case. They're not mature, meaning they're not making sufficient surfactant. I can't say that fast. Sufficient surfactant. And if you try to deliver them, they'll die. Now, I say this is the last thing that's going to allow that child to be born and survive in our world. If we deliver a baby and it's 28 weeks along, there'll be sufficient surfactant, probably. But could the child be blind?
Yeah.
I mean, the eyes are still developing well into the third trimester. Could the baby have brain damage?
Yeah.
Because the brain's still developing. Could the child have paralysis? Yeah. All those things can still happen, but it can survive. This is the last thing that determines whether or not a child will survive in this world, whether it's producing this or not. So that's why surfactant is important.
And how did you say you tested it?
Well, it's usually not produced enough until about week 24 to 26. But it starts being produced around week 22, 23. We can give mom a little injection that would eventually help the baby produce more if we have to deliver a baby early. But we're going to expect that the child's going to have some sort of respiratory problems.
Oh,
So you don't continue, you wouldn't continue to produce surfactant after exiting.
Yeah,
Like you would continue or you would?
you would.
Would. So,
We do. You do right now.
Yeah,
Okay,
so,
wait, listen. So you're producing surfactant right now.
so does that mean, what was my question? So does that mean that, we're just waiting for them to have enough of it to survive in the meantime as their body's making more?
Yep.
Gotcha.
That's exactly what it is. It's just one of those good things to know about because you'll hear people say, well, they can't deliver the baby yet because the lungs aren't mature. Well, the brain's not mature either, but the child can still survive.
Mhm.
The eyes aren't mature either, but the child can still survive. Does that make sense?
Yes.
I mean, you never want to deliver a baby early anyway. You always want to keep it in the oven for the full time. It's like taking a cake out.
That just,
Yeah.
I've been birth at exactly 40 weeks. My due date, they said I was in birth.
And you did on those days?
Huh?
And you did on those days? You followed the directions? The doctor said you're gonna deliver on such and such date, and you did?
No, I was going to do it at 12 o'clock that night. And then they sent me home, and then I was making a 7. I didn't give birth until 7.
Why'd you go home?
They said I wasn't open enough.
Why weren't you open enough?
They said I was only 3 centimeters.
Why weren't you more centimeters dilated?
I don't
Weren't you concentrating?
know.
Didn't you do the homework?
No, I didn't do no homework.
Yeah, see, so it's kind of your fault then.
I used to go do labs. Oh, God. Go on down exercise.
wait, I
Did that
actually have
help?
a question.
Yes.
I had seen someone posting about this, so I was of course thinking, well, I need to put that either fact or fiction. So this lady had like refused to let the doctors cut the umbilical cord, and like her whole thing was she wanted to keep it connected for 24 hours, like to the placenta anyway. So like the doctors and everybody in the hospital was like coming to her trying to get her to change her mind, and then apparently they did research about it and it seemed that it is actually more beneficial. So I'm just wondering if that's true or not, like to keep the baby attached to the placenta.
No,
Okay,
there's no benefit to that.
gotcha. I wasn't sure if it was like she was still trying to release whatever was, all the nutrients left in the placenta or what.
No,
people think the placenta is this magical thing.
it's a,
That's
it's a
all
filter.
wanted to understand.
Yeah, so once it's disconnected from the mother, it's doing nothing, right?
Right.
Right.
Baby's blood is circulating through it still, which means blood's gonna be lost. Some blood's gonna be lost that way, and then blood still returns back to the baby. So if it's,
Yeah, it was just an
it's much
interesting
more-
thought, so I was like, wow, I wonder if that is true.
It's much more prone to infection once it's out of mom.
Hmm.
Which means that's an infection that can go into the baby. There's just no benefit to it.
Interesting.
I know they talk about, well, you can get the cord stem cells and blah, blah, blah. Well, yeah, you could, but you don't have to keep it attached to the baby for that.
Hmm.
Cut the cord, man. Give it up.
Interesting.
Yeah, eating the placenta is cannibalistic.
Yeah,
We
I would
talked
assume
about
that,
so-
that's just nasty.
Right, we did talk about that.
Yeah.
No reason to do that. Terms related to the lung. Lobes, well, that's because it's divided into sections. How many lobes does the right lung have?
3,
3. How many lobes does the left lung have?
2.
2. Good. We talked about the diaphragm. Anybody know what that is? We talked before about the mediastinum. The mediastinum is the central area in the thoracic cavity, includes the heart as well as the great vessels.
Like right there.
Centrally located, like right here. Okay. Alveol, this is gonna go into plural forms. Alveolus becomes alveoli, and that is the little sacs. Bronchus becomes bronchi. Cilium becomes cilia. So the question is, well, what the hell is cilia?
Little finger-like projection.
Those little finger-like projections that are going to sweep. Cilia sweep. That's what they do. Cilia sweep. And in this case, they're going to sweep in what direction?
Down.
Ooh.
Oh wait. Wait, in what case?
In the trachea, for instance, bronchi.
Oh, in the bronchi. Oh, the bronchi move up.
Yeah, they're going to sweep up this way. Because what are they going to be sweeping up?
The oxygen. No. The
What
blood
coats our airway?
Mucus.
Mucus. And let's put some mucus here. And what is the purpose of mucus?
Trap bad stuff.
To trap bad stuff that we don't want getting deeper into our lungs. Once we trap it though, what do we want to do with it?
Smell it.
We want to get rid of it. So if we have all of this bacteria and garbage trapped in this mucus, now we want to get rid of it. These cells have these little finger-like projections. These are not sticking out of the cell. This is all cell membrane. But they do have machinery that runs up the length, and it causes them to sweep, in this case, in an upward direction. And that's going to cause that mucus to get swept upwards and upwards and upwards until it gets to the top.
Which is our mouth?
Actually, no, it doesn't even make it that far.
Oh.
To where our esophagus is. And then we swallow it. All day long, you don't even realize you're doing it. Relax, stop making that face. All day long, you're swallowing this mucus with all those pathogens.
Why are we swallowing? What's the point of
That's
that?
what I'm saying. Like,
Why
it's
bring it back
going
up
down
and put it back down?
Pushing it back down.
Yeah.
Pushing it up.
When we swallow it down the esophagus, where does it go?
To our stomach where the
Oh, to
bile
the
breaks, or where the acid breaks up.
Acid.
Gotcha.
Oh, okay.
Can't be that easy.
Can't be.
Just like that.
Oh, because I was thinking like it's going back up our mouth. Just come
I just
in.
thought that's when we cough and, get it
Oh, we
out.
do. That's also another way to get rid of it. Oh, but you're not
When we're
coughing
s-
all
I'm
day
assuming
long.
we're
But
sick,
all
it's
day
just-
long, you are collecting particles in that mucus.
When we're sick, does it just more times come out because there's so much more of it?
So much more of what?
Like mucus production when you're sick?
Why would there be more mucus production?
Because there's more bacteria?
More bacteria. The body says, there's more bacteria, we must make more protection, more mucus.
So then
That's why mucus is not the enemy. Mucus is the body's trying to
expel.
do exactly what it's supposed to do and trap as many of these particles as possible. And then, of course, unfortunately, there becomes a lot of it, so it makes it much more difficult to move up. And the thicker it is, the more difficult it is to move up, which is why we then get things like mucinex, which helps to break it apart, makes it easier to cough up. That makes sense? It does? So that's what cilia are. Now this is important, ladies, because you have cilia in another place in your body.
So vaginal canal?
No,
No.
fallopian tubes.
That too.
Because that egg that comes from the ovary
Needs to be pushed.
has to go from here to there, the uterus. So one of the things that helps move it along are cilia. Help sweep it along. That's what cilia do, they sweep. Now, of course, the fallopian tubes also have muscle in their walls that helps to push it this way also. So you have two things. You have cilia sweeping, and you have muscle pushing.
So,
Getting that egg from here to
and
that uterus.
how long did you say that process is?
5 days. To travel about 5 inches.
That's really slow.
Change your day.
You would think it would go a lot faster. Wow, that. Alright.
Trying to think of what is the opposite of the Fast and the Furious when it comes to eggs. I got nothing. Nothing at all. It's just,
Yeah.
yeah. Okay, we'll talk more about rails later on. Those are an abnormal breath sound. You hear a wet rail, sounds like a crackling sound in the lungs. Sputum, you probably don't usually hear plural sputa, but you've probably heard of sputum.
Honestly, no.
I was like,
This is sputum.
Mucus and bacteria.
It's the mucus and all the bad stuff combined that you're coughing
Oh
up.
wait, I've heard of that before actually. Sputum.
So when a person has like a pneumonia or bronchitis, and they're and they cough up a big,
Sputum.
you say spit it in here
Ew.
because we want to look at it. We want to take it and we want to see what grows. So we'll swab it and put it on a petri dish and see what kind of microorganisms grow.
oh. I don't think it was looking at it under a microscope to see what's already there, not. That's
Well, it's difficult to do that. It's difficult to isolate out bacteria that way or fungus that way.
Oh.
Much easier to put it on a petri dish than you can isolate and see individually what's growing.
okay.
And in case you didn't know, the plural for trachea is tracheas. Again, I'm not sure how often you have the use for the word tracheas.
Yeah, that's what I was just gonna say. Like, all of these cadavers here have tracheas.
I especially like how you did the arm, like you were Price is Right.
These all have tracheas. That's funny.
One inspiration, one expiration equals one respiration. We talked about that. So I do have a little bit of an issue with this diagram because inspiration, it looks like it's pushing down on the diaphragm with this arrow like this. It's not pushing down, the diaphragm is flattening out. Does that make sense?
Yes.
So the arrow is supposed to be showing that the diaphragm is more flattened than dome shaped. But by putting it here, it makes it look like it's sort of like pushing on it.
Yeah.
But it's not. This is just the diaphragm flattening out. And you can see how the lungs take up a lot of space. You see this right here? There's like no space right in here. As compared to when you breathe out, notice how the lungs collapse?
Yeah.
Wait, what?
See the space right here?
Oh, I see the space.
See how it disappears?
Yeah,
That's because these lungs have gotten bigger
yeah.
as you breathe in. Inspiration, diaphragm contracts. Vertical dimension of thoracic cavity increases. Actually, the thoracic cavity increases like 3 different directions. Because again, remember the ribs are like this, so as you breathe in, it's sort of hinging this way. So it's sort of expanding this way, and this way, all at once. Coughing. Why do we cough?
And then.
To expel the bacteria.
Get rid of things that we don't want there. What is dyspnea?
Dyspnea?
Difficult, painful, or abnormal
Breathing.
breathing. Difficult, painful, or abnormal breathing. Has anyone ever had dyspnea?
Yeah, I was gonna ask the
Of course you
question like,
Everyone has.
some mornings I'll wake up and like I have an extreme pain in my chest, I guess, every time I breathe, and it'll last the whole day and it won't go away until I wake up the next day. But it's like
Have you traveled outside of the
up
country?
here. No, I have not.
Okay, just check.
But it's like up here, so now I'm thinking like, oh, I probably was feeling like my lungs in my chest or something. I don't know.
Skeletal muscle pain.
Interesting.
You talked about cyanosis.
Yes.
We talked about- and breathing is an involuntary process, right? You don't have to think about it, thankfully. As many of you would have forgotten. Supposed to do. Oh, yeah. Breathe. Is involuntary, but we do have the ability to change the rate of breathing, don't we?
Mm-hmm.
Can you hold your breath?
Yes.
How long?
2 minutes.
Let's find out.
Oh, I was just gonna try it.
Can you breathe faster?
Yes.
Can you make shallow breaths?
Yeah.
Can you take a deep breath?
Yep.
Why do we sneeze?
Get rid of bacteria.
Get rid of things that are in the airway, especially in the nasal cavity, we want to get rid of. Not just bacteria, but things we want to get rid of. Could be fungal, could
Well, I need you
be
to explain these next.
allergens, it could be
Particles.
particles, as long as they're larger than 10,000 Daltons. I think anything smaller than 10,000 Daltons, the body doesn't even recognize. It's too big, it's too small to recognize. What about hiccups?
Yeah, those last two I need you to explain.
That's a body reflex too, but I don't understand why.
Extra air or something to do with air exchange?
Yeah, I have no idea how to do that.
I don't know.
Really, nobody knows?
No. One of my biggest mysteries, I mean.
I was hoping you'd be able to help me out on this
I
one.
think when you eat too
Darn.
fast, you can reflex.
Wait, what? Say it again?
Is it like because there's an air bubble or something?
You're eating air bubbles? That's like a burp.
Or when babies drink, they get hiccups.
Yeah, like when you first take a sip of soda or something, you get hiccups. Is it carbon dioxide?
Soda.
I don't know.
Yeah, no, when I first take my first couple sips, I started to get
Soda.
Oh, is that a pretty vase?
Nope. That would represent the phrenic nerve. So remember, in order for a muscle to contract, it has to be told to contract.
Yep.
The phrenic nerve is what tells the diaphragm to contract. Sends a signal that says now contract. That signal is going to come down in the form of an electrical current, right?
Yeah.
Hopefully you're picking up on that. And it's going to tell that diaphragm to contract. Problem is, the phrenic nerve does actually begin near the esophagus, the food tube. So if you eat something or drink something that irritates the wall of the esophagus, that irritation might be transmitted to the phrenic nerve, where the phrenic nerve picks that up and thinks that's,
Contraction of the diaphragm.
but it's a small,
Oh, that's why.
intermittent.
Gotcha.
So it sends a small little signal to the diaphragm.
Huh.
So what do we want to do? Well, we want to stop the hiccups, right? So how do we stop hiccups?
Scary.
Hold your breath.
Just scary.
Drink water upside down.
Hold your breath.
Scare somebody.
What happens when you hold your breath? And I mean hold your breath until you almost pass out.
You stop air from the brain.
Okay, yeah. So what's your body say? What's your body want to do?
Breathe.
Breathe.
The brain says, please breathe.
So you take a deep breath in. Well, in order to take a deep breath in, the diaphragm has to make a deep contraction, a big contraction. In order to get a big contraction, there has to be a big signal sent down. And the idea is that that big signal is going to override that little signal and reset the nerve, and there, of course, the diaphragm.
So to stop
will
hiccups, you hold your breath?
Yes.
Oh, okay.
So what happens while you're holding your breath? You can't hold your breath that long. You hiccup again.
You hiccup.
Just keep,
Yeah, I was thinking
just
that.
keep holding your breath.
I was thinking that you might hiccup.
Just keep going until you're at
That's
the
usually
point
what
where
I
you're
do.
going
I'm like, ah, whatever. It
What
didn't happen.
about
Water, like having water thrown at you?
Drinking water.
Drinking water, well, that could help too. Drinking water would help the hiccups.
It
Why?
would stop the irritation.
No. What do you do when you're drinking? What don't you do when
Oh, you
you're
stop
drinking
breathing.
water? You don't breathe when you drink water because you're drinking. Otherwise, you would start to choke. What about when somebody scares you?
Stop
You
breathing.
hold your breath.
No, you don't hold your
Yeah.
breath. You take a deep breath in. Big giant signal right down to the diaphragm overrides that.
I hold my breath.
I'm not easily scared.
I'm scared. I'm like,
I'm gonna run around home.
Today is
Wednesday.
Wednesday, right? Tomorrow's Thursday.
I thought it was Friday, but
It's not.
you know.
So what's gonna happen next week is we're actually gonna move the anatomy exam to Tuesday.
Yeah.
Wait,
So,
the anatomy exam this upcoming Tuesday,
yeah,
as in 6 days from now.
yeah. So
Are we
that
getting those
means
packets?
I'm gonna give you all the packets tomorrow. You're gonna have to figure it out all over the weekend.
I'm gonna get them today. That's a day. That's an extra day.
I'm just joking. But I was seeing if you were scared. Because you're like, I'm not easily scared.
I'm a little no, I'm easily stressed and anxious.
No.
Very easily.
Thursday.
That's not hard to do.
So we're gonna get them tomorrow. What
Um,
about for this class?
for this class,
We have a fun final for this class.
this class is gonna be difficult. Because there's a lot of material that you guys need to cover. And
You were action too.
only I had like
Like a
a
paper.
review sheet of some kind.
That you have here.
Or a couple of them that would cover this course. Which I'm gonna make copies for you on the next break. And you'll be, if we had a bigger group of people in this room, if we had every seat in this room taken, and I have the door shut,
More people would yawn.
or if we had a smaller classroom and even like more people, and I kept the door shut, you would see in a short period of time, people, stop it. Everybody yawn. People would start yawning. And then you would see the difference as soon as I opened up the door. Like that one classroom that's down the hall, it has 2 doors on it. If I'd opened up both of those doors, you'd suddenly see people yawning less. And if I shut the doors, within about 45 minutes or an hour, you'd start to see them yawning again. So it's one of those things that you can actually, the theory you can actually test that way. Because of course, if we have a lot of people in the room, using up a lot of the oxygen, there's less and less oxygen in that room at that time. That's why I said that. But if you open up the doors,
I can't stop it.
It's all
Okay,
about-
Right, like.
look away or do
Literally like
something.
3 of
Open
us
the
are all
door.
yawning.
It keeps coming.
Yeah.
Oh.
Open the doors and just have your.
So why is it contagious? That is something that is still not really clear.
But it is.
Yeah, the theory, a theory, is that from our early developmental early years of development, or early years of evolution, it sort of helped to recognize that we were part of the same group. Kind of the same way that when one wolf begins to howl, all the other wolves begin to howl.
Interesting.
This sort of says,
We're all Americans.
I think we're on like 8 times in a row.
yes, I'm tired because just like you, I get up early in the morning and hunt, and then go to bed at night and sleep at the same times. So that's sort of the most accepted theory, although it's still kind of not completely clear as to why.
Wait, so then does that explain why, like when you wake up in the morning or when you're tired in general, like are you yawning more because your body has less energy to get the oxygen around your brain?
Probably yes.
Gotcha. Okay.
If you didn't sleep well, like because of sleep apnea or something?
I'm reading why pneumonia is contagious.
I'm wondering what you're finding.
I'm on,
Oh jeez. Oh jeez.
Jeez. Everybody's going pretty much that. These words all mean the same thing, right? They must, because they all start with this.
Dyspepsia. Difficult, painful, or abnormal.
Right.
Breathe it.
Dyspnea, okay, then what's dysphagia?
Phage. What's phage again?
Swallowing. So eating or swallowing.
Oh, right.
Dyspepsia.
I drink.
You can only drink Coca-Cola. Pepsin is one of the things that we find in our stomach that breaks down particles. So dyspepsia is when there's an abnormal production or release of this, which is what's going to cause that heartburn. Okay, I want you to listen to this, because here's where pronunciation is important. The first one at the top, bradypnea.
What?
Bradypnea,
Oh.
not bradypnea.
Well, that's how I'm gonna say
Uh,
it.
Yeah.
Don't.
Braided.
You will be expelled.
Did you say braidipnea?
Bradypnea,
Braidipnea.
not bradypnea.
Braidipnea.
Bradypnea.
Braidipnea. Dyspnea.
Dyspnea. Dyspnea.
Ah, you
Dyspnea.
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 No, I don't like that. There needs a new vowel in there.
Dyspnea.
There's an E, so it's dyspnea.
It's not dyspnea. Dyspnea.
You know what?
Dyspnea.
She said this.
Dyspnea.
Nah, that is
There's an E in there now.
I'm going to jump down. Hyperpnea. Hyperpnea.
Wait, oopnea?
I said I'm going to skip down. Hyperpnea. Hyperpnea.
Hyperpnea.
Tachypnea.
What?
Listen to me. Not tachypnea. Not tachypnea. Tachypnea.
What do you mean?
Nope, that's canceled.
Yeah, this is something
This whole
wrong.
thing is
Something's
canceled.
going on here.
That whole thing is
It
canceled.
sounds weird. It
Oh,
sounds
gosh.
like
We're gonna create a whole new medical dictionary, guys. Let me tell
Whatever
you.
it was not it.
That's tachypenias.
That ain't it, fam.
Yo, Brooklyn, she gets frustrated.
This is so funny.
You want to grab this?
Tachypnea. What do you mean?
That's like a medical Bible right there.
Oh gosh. That's hilarious. Tachypenia?
Oh,
She said,
Tachypnea.
it is right.
Tack?
Tachypnea.
Like I don't understand all these little things up here, but tack?
Tachypnea.
Ah. That sucks, man.
If you ever have a question, Tabers
Or Google.
You
or
can
Google, whatever.
and
You
it's
would think, but
Old
Google
school.
Maps would pronounce things wrong all the
Okay.
time.
I went through these with you and I said, pay attention, this is important.
No, we were paying attention.
Because here's the problem. I guarantee you, you're gonna run into people who say tachypnea or
Tachypnea.
hyperpnea.
She said tachypnea.
said
Tachypnea.
It's tachypnea.
Wait, say it again.
Tachypnea.
Tachypnea.
And then
So
hyperpnea, how do you say
So
that like
let's,
that again?
let's go back, hold on, let's go back to the top,
Okay,
because that was just the pronunciation part. Bradypnea, what does that mean?
breathing, slow breathing.
Okay. Dyspnea,
Dyspnea, difficult or
difficult,
painful.
painful, or abnormal breathing. Hyperpnea,
Hyperpnea.
Wait, even
Hyper,
breathing.
just like hypertension, so it's above high breathing or something? Or
Yes.
that's
increase,
increased breathing?
Yeah.
yes,
Okay.
as compared to tachypnea,
Which is fast.
which is fast
Which
breathing.
is.
So tachypnea can look like,
Tachypnea.
Sound like catnip.
tachypnea can look like this,
Asthma?
whereas hyperpnea
That's how I
It's
sound
just-
after.
can look like this. Do you see the difference?
Yes, deeper
Okay.
breathing.
Then that takes us to this one. EU is pronounced U.
Eupnea. Eupnea. Eupnea.
Eupnea.
Haha, that would make sense.
That's
This
normal.
means normal.
That's normal.
Now, the reason why you've not heard of this or you'll hear about this less is
A
because
lot of things are normal.
oftentimes we don't make chart or notes in charts about normal things,
Oh, this person's breathing
right?
normally.
We would say that if we had an expectation that they wouldn't be breathing normally, or if they hadn't been breathing normally before, but now they are. But we wouldn't just put down normal breathing as a sign or a symptom or anything that could help with the diagnosis. We would put down things that would be different. So there will be other times you will see things that start with EU, pronounced U, and that means normal. Eupnea.
EU equals normal.
But I want you to hear these words because you're going to run into people who mispronounce them, and you're just going to have to let it go because we've given up.
We were those people.
Yes, you were.
So it's dyspnea.
Just us 5 minutes
So
ago.
if there is not.
But
Dyspnea.
were you taught it that way?
Yeah.
It's territory.
So it's
That's
dyspnea.
dyspnea.
Are you
Dyspnea?
sure it was never
Dyspnea.
P-E-N-A? Or no, it was just
Dyspnea.
Wait, I'm gonna need you to go over this
And
stuff
it's been
because
that way?
I'm
forgot.
lost.